SIRUM's goal is to save lives by recycling unused medicine that would otherwise go to waste. We do this work because of people like Maria, who I've actually met at one of our clinics we work with. She's a mother. She's actually going to night school to hopefully get a better job and provide for her family. But Maria also has high blood pressure and diabetes, and she can't get health insurance right now. The cost of her medications on a monthly basis are over $200. For a low-income person in America, $200 is a lot of money. In fact, the cost of medications for a month can be more than the cost of groceries. So for Maria, it's a decision constantly between buying the medicine that she needs to stay healthy and paying for rent, buying groceries for her family, and other necessities. This is about Maria, but this is also about the 1 in 4 people like Maria who can't afford the prescription drugs they need to stay healthy. That's 50 million people. And even with the Affordable Care Act insuring millions, folks have issues who are insured as well. They have high copays, they have high deductibles that can range up to $6,000 for an individual in a calendar year. That simply makes medicine unaffordable for them. According to the American College of Prevention, when people don't take the medicine that they need to stay healthy, it costs our healthcare system up to $100 billion. And without your health, we know there's no going to school, there's no working, there's no taking care of your family. This is not just an issue of medicine access. This is an issue of social justice. This is an issue of equity for our most underserved populations right now. In a system, in a country where we spend $3 trillion every year on healthcare, it is unconscionable that people like Maria, that 1 in 4 people in the United States can't afford the medicine that they need to stay healthy. At the same time, then meet Dean. Dean is actually a nurse, the director of nursing at a health facility in San Jose. This is Dean and one of her nurses doing a process every month that they would do, which is take all of the unused medications that they had that were unused, unexpired, unopened, and not needed because of various patient events like discharge, dosage change. And every month, her and a nurse would actually take these medications and destroy them. She would pull them out of the bottle, she would empty creams and vials and liquids and put them in a big medical waste incinerator bin, destined for some place that looks like this. So currently, meds from health facilities and pharmacies in all areas of the healthcare supply chain, medicine that's not being used is hopefully ending up in a medical waste incinerator. We know that folks at home, medicine cabinets, oftentimes what's happening is people are flushing it and it's ending up in our waterways. But certain studies have showed that 70% of waterways across 25 states in the United States have trace elements of pharmaceuticals. And we know that the cost of production of prescription drugs is very high to our environment. For every pound of active ingredient that's produced, a report by the National Resource Defense Council showed that up to 30,000 pounds of waste is generated. So 1 pound of active ingredient can easily generate 30,000 pounds of waste. And we're literally destroying medications. And actually, when we talk about kind of an environment of abundance, currently $5 billion of unused medication is going to waste every year in the United States. That's $5 billion of unused medicine, while at the same time 50 million people can't afford the medicine they need to stay healthy. This is actually a picture of myself and my 2 co-founders. And we started SIRUM. And so George Wong, one of my co-founders, he was actually a geneticist, had a biology PhD from Stanford, and decided he wanted to take his skills out of the classroom, out of academia, out of kind of the white paper world into the real world. My co-founder, Adam Kircher, had a background in industrial engineering, was really inspired by looking at inefficiencies in supply chain management, which is, I know, super, super exciting. And had actually been inspired by looking at inefficiencies in relief efforts, particularly after natural disasters. And myself, I grew up in West Philadelphia, and I grew up passionate about helping communities like the ones that I came from. And the 3 of us we'd started this actually as a passion project. We started out at Stanford University, literally bootstrapping this idea nights and weekends, and we would constantly talk about, how can we make this thing work? We know there's all this surplus. We know this need. How can we connect them? We felt passionately that there was technology that we could use simply to help bridge this surplus and the need. Here's the rub, though. This arrow right there is when we started SIRUM. So in the midst of the financial crisis, we were bootstrapping this issue because we ultimately knew that people needed medicine. And during the worst economic recession, people had the worst need and the most compelling need. But, it was very risky. And we all knew that it was very risky to start this as a bootstrapping project when we all had other careers. And it was riskier still when we got just the first little bit of funding to get by and make it work for a year, to actually start SIRUM. So around 2011, we actually all quit our jobs. My co-founder, George, stopped out of a postdoc. Adam actually left business school at Harvard. I left a career in public-private partnerships at the Clinton Foundation to really get this program off the ground. And when I say we were scrappy, I mean that we were really scrappy, literally to the point of we needed to do basic things like provide medicine donors with boxes. We didn't have a budget for boxes. We barely had enough money to pay our rents and, actually make this program work. So there was actually a point early on in SIRUM where we knew from George, who was a scientist, where we could get some really good quality boxes for $0. That location happened to be the dumpster behind the biology lab that George used to work at. So literally in the dead of night, we would drive onto Stanford's campus, load up Adam's big SUV, we would back it into the driveway behind one of the biology labs, and we would literally go dumpster diving for boxes because we had no money in our budget to do so. This is the inherent risk. And these are the types of scrappy things that founders are constantly dealing with and having to make it work. And, it took just a little bit of risk capital, a little bit of money from a couple foundations to actually help fund us from this completely bootstrapped, nights and weekends, dumpster diving in the back of biology rooms to actually going full time and creating a program. And, there's just there's too little risk, specifically when we talk about the social sector, when we talk about philanthropy, in trying something new, in taking a chance on something that might fail. And there were many, many times as I was climbing into the dumpsters or helping George push boxes out of the dumpsters that we did worry that it might fail. But thanks to a couple folks who were willing to really believe in us and hearing many more no's than yes, we were able to get a little bit of funding to make it happen. And so in 2011, we started working really hard on what the product would be. We started going around and shadowing nurses, pharmacists, anyone in the healthcare industry to figure out how can we access this waste? How can we get it efficiently to folks who need it? And we developed a platform at that point that would help nurses like Dean do something really simple like scan in the medicine that she had surplus of. And it would automatically show her what she could donate and where she could donate it to. And then we made it super easier for people like Dean to then pack up those medicines so it could go directly to a clinic that needed it. We recognized that we could save both time and money for these facilities, time on the side of they were otherwise destroying all this medicine, and that's terrible for a nurse to do, and money because they were actually paying $3 a pound or more to destroy unused medications. So we built out a service that would allow people like Dean to easily recycle the unused medications that she had in her building. And then we built out a platform on the receiving side where we could work with clinics and help them manage the inventory of medications that they receive through donation. SIRUM coordinates all of the logistics like shipping, tracking, inventory management to make it super easy for people to recycle these unused medications. So now people like Maria can go to one of our partner clinics and access the medication she needs to stay healthy for free. At its core, we are really a simple supply and demand, but from a bird's level view, it's actually interesting that we're working at an intersection between business, policy, and the social sector. It makes good business sense to donate your medicine. It reduces the cost that these facilities are paying to dispose of medicine. There's also some tax deductions and implications that can come from that perspective. We're at an intersection of policy because until recently, it was not legal for a lot of these health facilities to donate their unused medications. They literally had the option of destroying them or using them with patients, and that was it. It really is the past 5 to 7 years that there have been sweeping legal changes, Good Samaritan laws that have gone state by state that allow these medications to be donated instead of destroyed. And ultimately, we're providing this as a business service for clinics that serve the most underserved populations in the United States. So from going dumpster diving to the past few years, we've actually grown exponentially. In the past year alone, we've tripled the size of our program to now donating enough medicine for over 20,000 patients every quarter to get medication they would otherwise not be able to receive. And this really comes from embracing this nexus of partnering across business, policy, and in the social sector. And our footprint from California in the last year has grown from just a small California program to 4 states. We've actually helped redistribute over $5 million of unused medicine. That's enough for 80,000 patients who otherwise wouldn't get the medicine. We've developed a playbook to actually get across these other states, and we anticipate being in 40 states that have drug donation laws into the future. There are 40 states that we could be working in, and that is really our goal. So where do you come in? I've heard it said that government steps in where the private sector fails, and the social sector steps in where government fails. I say that we're all in this together. In this room, there are billions of dollars of brands being represented, Fortune 500 companies, philanthropies. The biggest risk you can actually take is by taking no risk at all. I'll end with a quote by Margaret Mead. Never doubt that a small group of thoughtful, committed citizens can change the world. Indeed, it's the only thing that ever has. We believe strongly that it's folks like you in this room who can help by taking risks on organizations like SIRUM and other startups that can ultimately help a situation like this where there's $5 billion of unused medicine, 50 million people who can't afford it. Ultimately, we need the support and we need the risk-taking for people like you in order to be successful and in order to create scalable programs to solve some of the world's most intractable problems. Thank you.